Now, if you are struggling with prioritization question, this is the only video you need, right? I'm going to break everything you need in order to prioritize on the NCLEX exam, right? If I can show you a way to prioritize on the NCLEX exam, a way that when you see any prioritization question on the NCLEX exam, you are able to kill it, right? This is the video you need, right? I understand NCLEX prioritization, but I'm going to introduce you to what you need to know based on this video. Now, there are a lot of prioritization questions on the NCLEX exam. Prioritization don't mean we are seeing unstable patients. Prioritization can also mean we are seeing stable patients, right? But in this video, we are going to be dealing with unstable patients. Now, in order to prioritize, you need to know how NCLEX write prioritization question. Now, let me tell you how, right? We have unit based. Now, number one, we have unit based prioritization question, whereby the NCLEX might make you prioritize based on a certain unit, right? It can be maternity, right? It can be PEDS, it can be ICU, it can be the emergency unit, right? Just unit based, right? Yeah, prioritization also involve disaster, right? But you can prioritize based on disaster, you can prioritize based on medical condition, prioritize based on surgical condition. Now let me just leave it like this, right? We are not doing this, right? We are not doing this, so we are just doing this, right? Unstable patient. Now, unit based, disaster, medical condition, surgical condition. The moment you understand the principle we use in the prioritizing based on unit based, when you get any unit based question on the exam, you'll be able to answer it. I'm not talking about this today, right? So for disaster also, I'm not talking about this today, but if you understand the principle of disaster, you'll be able to prioritize using that, right? NCLEX wants you to use a certain principle, but this is what I'm going to be focusing on based on this question I have right here, right? Medical condition, surgical condition. Now, when you prioritize using medical condition, let's talk about prioritizing using medical condition. Now, when you want to prioritize using medical condition, right, you prioritize using what? The body system affected, pathophysiology of the diagnosis, right? You can either use the body system or the pathophysiology. Anyone you just remember, right? The body system or the pathophysiology to prioritize, right? Same as well to prioritize. Now, that's how medical condition work. Why? For surgical condition, we prioritize using understanding of complication. We asking ourselves, is this expected? Is it expected or not expected? Right? That's what we're asking ourselves. Is this complication expected or not expected? Now, these two, right, be it surgical condition or medical condition, the NCLEX can give you intervention or sign and symptom. Right, the NCLEX can either give intervention or sign and symptoms. So the intervention, you are going to ask yourself, is it a good intervention or bad intervention that you need to prioritize the patient? Is there anything surrounding the intervention that we need to teach the patient? Now, this is secret one. NCLEX don't prioritize teaching. NCLEX prioritize treatment over teaching. Any patient that needs teaching is not a priority, but treatment is a priority. So if you see any of your option that we just need to teach these patients, we don't prioritize that, but we prioritize patients that need treatment over teaching, right? Over teaching, right? So NCLEX can also give you symptom. So the symptom, if it's a medical condition, we're asking ourselves, is the symptom related to the body system of the diagnosis, right? If we have a patient that's having hypertension, this is a cardiovascular problem, right? If the symptom is headache, right? If the symptom is headache, this is or neurological problem. The symptom is not related to the diagnosis. So this patient might likely be priority, because for a cardiovascular system to cause headache, it shows there's something going wrong. Now, the principle of care is that we, even if we don't want to give immediate care, right, we want to make sure that the body system that is affected don't affect other body system. Like now, if a patient is having heart failure, like now, if a patient is having heart failure, right? Now, the NCLEX might tell you the patient is having edema. This is a cardiovascular problem, and this is a cardiovascular symptom. The patient might tell you the patient they're having their let us say their pulse is 120. This is also a cardiovascular symptom, right? So they are all related to cardiovascular, cardiovascular. Unlike the NCLEX might still say same heart failure, and the patient is having shortness of breath. The patient is having the patient is restless. Let's say the patient is restless. Now, this is a cardiovascular symptom. This is a respiratory symptom. This is a neurological symptom. It means there's a problem, because it's no more affecting the cardiovascular problem, is now affecting this. Now, the wrong thing a lot of students do on the NCLEX exam is that they say, oh, this is an expected finding. This is an expected finding. If you do that on the NCLEX exam, you are going to fail. You are going to fail, right? The only reason why you might not fail is if you don't get a lot of prioritization questions on the NCLEX exam, right? So if you want to prioritize, NCLEX don't prioritize expected finding. NCLEX wants you to think as a nurse. What is the problem? Who should we see first? Not expected finding, right? There are principles to prioritization. NCLEX is very big on CNR, which is cardiovascular, neurological, and this is N, right? And respiratory. NCLEX is very big on that, because NCLEX believe that for a patient to die or have the most biggest complication, the cardiovascular need to be affected, the neurological system need to be affected, the respiratory system need to be affected. NCLEX is very big on that. That is your level 1 patient. Now, one thing I want you to know is that the NCLEX don't want you to prioritize based on diagnosis. The NCLEX wants you to prioritize based on what the patient is experiencing. Sorry for my red. Right. The NCLEX wants you to prioritize based on what the patient is experiencing. Now, the NCLEX can say, oh, the patient have hypertension, 200 over 100, client 1, client 2, diabetes, blood sugar level is 110, right? COPD, shortness of breath, and let's say asthma, what can we say? Okay, let's say 90% oxygen, right? The NCLEX don't want you to prioritize based on the diagnosis. What the NCLEX just wants you to think about the diagnosis is to ask yourself, oh, is it because of this diagnosis that this patient is experiencing this? And then, based on understanding the pathophysiology, because the NCLEX wants you to know the pathophysiology, right? You can easily tell if this patient is what? Deteriorating. Easy, right? And that way you can be able to apply the principle of CNR. Now, let me introduce you to my method, right? After going through 100 of NCLEX prioritization questions. These are actually past questions from the NCLEX exam. So these are not just random questions from program. They are past questions from the NCLEX exam. I only do NCLEX past question. I don't do program, right? That's what I teach my students in my coaching program. We do NCLEX past question, because I want you to get used to the NCLEX exam so that you don't go on the NCLEX exam and start seeing a different thing. I want you to understand the NCLEX and not what people put together, because there's difference between nursing school exam and the NCLEX exam. NCLEX tests you based on concept. Nursing school tests you based on general knowledge. If you don't know concept that the NCLEX tests you, it will be difficult for you to understand the question. Now, based on my analysis, I noticed that NCLEX group patients into 3 levels. right? Level 1, level 2, level 3. Now, level 1, these are my CNR, right? Cardiovascular symptom, neurological symptom, and then respiratory. Now, level 2, we are going to come back to that. But level 3 are routine tasks or patient that what they are experiencing is really saying that they are stable, or they are okay. Let's leave it like that. Let's leave it like that. Or let me just add it, right? Or their symptom, right, is related to external factor. Let me put it. Their symptom is related to external factor, right? A symptom that is related to external factor is not a priority on the NCLEX exam. Just like now, maybe the NCLEX is saying the patient have COPD, they have deep dyspnea due to what? Stress, or due to a certain activity, right? Because the NCLEX used the keyword due to, or maybe trying to relate it. When we try to write our problem, nursing problem, we say we use this method, the PST, the problem, the etiology, the symptom. Now, what is the problem? Obviously, the patient have dyspnea. So why is the patient having dyspnea? The patient is having dyspnea. The NCLEX, if the NCLEX did not tell us stress, it means that the dyspnea, what we can think about as a nurse is that the patient is having the dyspnea due to what? COPD. But in this case, this patient is not having the dyspnea due to COPD because the NCLEX has already included what we call external factor. So now this patient is experiencing dyspnea, the etiology, due to what? Stress. Now you need to ask yourself, do we treat stress, or do we teach management method for stress? According to general knowledge, we don't treat stress. We teach how to manage stress. So the NCLEX prioritize treatment over teaching. So in this case, you are not going to prioritize it. But now, if you are prioritizing using the diagnosis, or you don't know this principle of level 3, you might think, oh, this patient is having dyspnea. It's a respiratory issue, and you might prioritize and you will get it wrong. Now, this is your level 1 thinking. This is your level 3 thinking. Your level 2 thinking is any patient that don't fall within this category. If your patient don't fall within the CNR, which is the cardio, neuro, respiratory, they are your level 2 patients. If your patient don't fall within the routine tasks, right? Stable symptom related to external factor, they are your level 2 patient. Maybe such like patient is experiencing pain, patient is experiencing having infection, like any other stuff that is not related to cardiovascular, neurological, respiratory symptom, right? Remember, I'm not saying cardiovascular diagnosis or neurological diagnosis or respiratory diagnosis. If your patient is having If a patient is having heart failure, this is a cardiovascular diagnosis. But if a patient is having edema, this is a cardiovascular symptom. So we prioritize based on what the patient is experiencing, not the diagnosis. So get me right. Now, in order to practice the question I want us to practice now, we are focusing on what? Medical condition and what? Or surgical condition. Remember, medical condition, we use this is what I do. I use my level 1, level 2, level 3 principle, and then the principle of deterioration. Now, for my level no, for my surgical condition, I think complication. Right, I think complication. Now, these two can have what we call intervention or sign and symptom. Now, for the sign and symptom, I group it right to the CNR. My intervention, I ask, is there a problem with the setting intervention? So, with that being said, let's go answer the question. Now, right here, you can see, let me just take this off so that I can have more space. So right here you can see that we have let me use my red color. Right now you can see this is a surgical condition, it's a medical condition, surgical condition, medical condition. So let's focus on the I like to be well organized, right? So now let me start with the surgical condition. When we talk about surgical condition, we are thinking about what? Complication. Because if you are thinking about the surgical condition, then you are the doctor now. Because if you are thinking about the surgical, you are telling me that you are the doctor, right? Surgical condition, we don't think about surgical condition. As a nurse, you think, what's your role? To do pre-op, and with any surgical condition, your role is to do pre-op, right? Pre-op care, post-op care, monitoring for complication. That is your role, right? So if it's a medical condition, you can think about the pathophysiology. That's how the NCLEX wants you to think about the body system affected and how to understand what is related to that body system. Now, so for surgical condition, I'm thinking about complication. I'm trying to see, are we having intervention or sign and symptom, right? Right here, I'm seeing that we have an intervention, high Fowler. So is high Fowler bad for the patient? No. So that's not a problem. Lying on their right side. Lying on their right side, I need to ask myself, should they be lying on their right side or not? Because if the NCLEX is telling us right, there's opportunity, shall I say, you can easily be thinking, oh, what is wrong with the left side as well too. So that way you can question yourself, should they be lying on the right side or the left side? But even if they should be lying on the left side, I cannot treat this thing. I cannot treat it. A patient that is sitting in high Fowler position, is it good or bad? The answer is that it is good. So there's no need for me to ask myself, am I going to treat or teach? If it is not good, then I will teach the patient. I cannot treat situation with high Fowler. I will just teach the patient that, oh, maybe the patient is not lying in, maybe the patient is not sitting in high Fowler and they need to be sitting in high Fowler, maybe based on their condition. I can then teach the patient or encourage the patient to be in that position, right? That is about uh this. And for this as well too, even if the patient should not be lying on their right side, I cannot treat. I can only just teach. And the NCLEX prioritize treatment over teaching. So I definitely know this patient will likely be my level 3 patient. So that way I'm gone. Now, is this intervention or sign and symptom? Definitely this is an intervention. Is it a good intervention? Yes, it's a good intervention, right? So it's not a problem. There's no problem right here, right? There's no need to question anything. Reporting coughing out blood from the lungs. This is not good. And if I look at it, it fall under my CNR, right? Respiratory. So I'm going to say this is level 1 patient. Now, the problem this patient is having is that they have only one problem right there, because NCLEX like to prioritize based on high level of acuity or amount of acuity, right? Their problem, the amount of problem they're having. Now, this is a surgical condition. Sitting high Fowler is not bad, so this is a no, right? So this one as well is out. I can easily place them level 3. Now, this patient is having heart failure. Yes, that's a cardiovascular problem, right? They are having productive cough, which is a respiratory problem. So this is a problem, right? It's under the CNR right there. The restlessness is respiratory neuro. It's a problem. So, right, this is a level 1 patient and they have 2 problems. Now, based on the 2 patients, you obviously know, right? Because level 1, we cannot prioritize level 3 again because they are out. We are only left with level 1 and level 1, which is your 2 and 4. Now, to prioritize, we know these patients have the most problem than this patient. So that's why we are going to prioritize level 4. Now, there's another method as well too to use, right? If you don't want to use this principle, there's another method. This is the best principle so far, so good. But I just want to show you that if you use audio principle, you will still get the same answer. Now, this is a surgical condition, this is a medical condition, surgical condition, medical condition, right? High Fowler, this involves teaching, so it's not treatment. This involves teaching, so this is a no because it's your level 3, right? These patients pause, this is a good thing, this is the problem right here now. But if you are using the principle of deterioration for medical condition, you want to think about the body system that is affected. Now this is a respiratory problem, right? This is a respiratory intervention, and as well too, this is a respiratory uh symptom. So they are all related to the respiratory symptom. So as at now, I cannot really say this is the best patient because the patient is having their symptom all related to the respiratory symptom. NCLEX might give me another patient that their symptom is not even related to the body system affected, right? Because deterioration means that the patient started with maybe a cardiovascular problem, and now it has started affecting other body system, or a respiratory problem, and now it has started affecting another body system. But right here, this is a respiratory problem, but it's still having issues within the respiratory system. It have not extended beyond the respiratory system. So I'm going to come back to these patients right now based on principle of deterioration. This is a surgical condition. Surgical condition don't use deterioration. Surgical condition use complication. So is this a complication? No. So this no, this is definitely going to be your level 3 patient. Now for number 4, this is a cardiovascular, this is a medical condition, so we can apply the principle of deterioration. This is a cardiovascular problem, this is a respiratory problem, and this is a neurological problem, right? And NCLEX is very big on CNR, right? CNR. And NCLEX wants us to prioritize based on what the patient is experiencing, right? This is just a guide to tell us, are we experiencing something related to the body system initially affected? This is just a guide that's telling us, are we still experiencing something related to the body system affected, right? But this one is still within the body system. Number 2 is still within the respiratory system. But number 4, we started with the cardiovascular, have extended to the respiratory, and then the neuro. And NCLEX is very big on even the neuro, but NCLEX is big on the theory though. But principle of deterioration means that if you have a medical condition that have started affecting other body system, you need to prioritize that patient, right? So number 4 again still stand as your high priority. So anyhow you want to use it, be it you are using the first way, the second way, you are still going to get the question correctly, right? This principle is not what I give to you is not a strategy, it's a principle of it's the principle of care, right? So if you want to care for the patient, right, in a way that you prioritize right, you need to be able to use this principle. So it's not a strategy that you need to start asking yourself various questions. You need to understand the principle and be able to apply it, right? First thing you definitely need is to be able to know your pathophysiology, your body system, right? Symptoms related to those body system, identifying symptom that is not related to the initial body system. Never prioritize using the diagnosis, but think about the diagnosis as a reference to what is going on, right? And that way you'll be able to prioritize right on the NCLEX exam. So if you have any question for me, right, or you want me to help you in passing the NCLEX exam, you need coaching one-on-one, right, I'm going to leave you my number. You can either text me, you can send me a WhatsApp message, right, or you can message me on Instagram, right? Instagram. So my number is +17676130769. You can text me, you can WhatsApp me, you can message me for iPhone user, direct text or WhatsApp this number, or you can check me out on Instagram, right? Let me open my Instagram account for you right here. So this is me on Instagram right here, future RN_PN.